The Minister of Health, Professor Isaac Adewole, says plans are underway to ensure that all local government areas in the country have GeneXpert machines for HIV and tuberculosis tests.
We're trying to deploy resources for tuberculosis management. We are deploying one of the most potent instruments for making the diagnosis, the GeneXpert machine. Our target is to have one in every local government. As of today, we have 394 GeneXpert machines in 315 local governments across the country. And so, but what we want to do is to make sure that the machines are used properly. There is no state without a GeneXpert machine. We will make sure that things are done properly in Nigeria and that we make Nigerians proud so that we will win this battle and end the TB epidemic by 2030.
The minister assured Nigerians that tuberculosis could be prevented and treated.
What we are trying to do is to sensitize our people about the burden of TB and to let our commissioners know that we need to work harder. One, to increase awareness about TB. TB is preventable, it is treatable, it is curable. And as stated by Dr. Lawansin, TB anywhere is TB everywhere. And so I think this is a good start for the year. And we will improve sensitization. You're also going to work with us. Let people know TB is not cancer. It's preventable, it is treatable, it is curable. And so we need to destigmatize TB so that people will know that it's just like malaria, it's treatable.
The Permanent Secretary spoke on welfare of health workers and accelerated access to services.
The focus of the Federal Ministry of Health is moving forward will be to rapidly expand services of TB and HIV. We shall prioritize capacity development of healthcare workers as well as the introduction of new drugs, diagnostic tools as it relates to TB and HIV control. We encourage all states to ensure full implementation of the National Strategic Health Development